that you have, say, 60 million people in the adult population. If 2/3 of them contracted COVID and 1% of those who contracted it died, we'd have 400,000 deaths, and that is unacceptable and liable to overwhelm the NHS. How did we, and you in particular, alongside everyone else, miss this for so long, for about 6 to 8 weeks?
Well, I would absolutely say that we knew about this problem from the start. And the challenge in those early weeks of March was making a massive judgment, probably the most significant judgment that any Prime Minister has made, certainly in peacetime, based on incomplete information and at great pace. So I instructed the department and the health system to plan on the basis of a reasonable worst-case scenario in January, in fact on the 27th of January. And I asked for a reasonable worst-case scenario planning assumption. And I was given the planning assumption based on Spanish flu, and it was signed off at COBRA on the 31st of January. And that was a planning assumption for 820,000 deaths. And I was determined that that would not happen on my watch. So throughout February, we were planning for how to stop that and how to deal with the consequences of if it came true. And in the middle of February, the scientific advice confirmed that the reasonable worst-case scenario should be taken as read, that this was equivalent to Spanish flu. I mean, if you think about it, at the time, at the end of January, when that was first presented at COBRA, I, like everybody else, thought of Spanish flu as something you read about in the history books. But as Health Secretary, you're always worried about new pathogens, when we're dealing with them all the time. But knowing that that was the reasonable worst-case scenario, we planned for it. And then we did the work in February, and on the 3rd of March, I set out to Parliament our, what we call the action plan, which set out all of the actions that we might have to take, up to and including shutting schools. I was asked about the media about it, about lockdowns, and confirmed that we would be happy to take those. But at the time, on the 3rd of March, when we set that document out, setting out all the things we might have to do and saying that we were prepared to do them, there were no deaths. Indeed, on the 3rd of March, there were 50 cases. The week beginning the 9th of March, what happened is that the data started to follow the reasonable worst-case scenario. And by the end of that week, the updated modelling showed that we were on track, essentially, on the track of that, something close to that reasonable worst-case scenario. I think the numbers were slightly below that, but they were of a scale that was unconscionable. So we then, therefore, on the 16th of March, when there were 611 cases and 53 deaths, we took the decision, we announced that everybody in the country should stop all unnecessary social contact.
So we know what happened, and we've got a clear view. It's all in the public domain, but it's evident, and everyone agrees. Sir Patrick Vallance said it would have been better if we locked down earlier. Neil Ferguson, I mentioned, said that it would have a big reduction in deaths. We didn't do what was necessary early enough, and it seems to me that everyone, or certainly most people in the system, got bogged down in the modelling and the complexity, and didn't step back to see the crude maths of it, if you like, and to take the measures that were eventually imposed earlier. And in trying to learn lessons and thinking back, you were someone that was involved in all of those discussions. How was it that you, but everyone else, didn't see the enormity of what was going on and took these literally incremental decisions to turn up the dial progressively week by week in terms of restrictions? Why did we miss the big picture?
Well, the clear scientific advice at the time was that there is a need to have the tools like lockdown at your disposal, but also that the consequences and the costs of lockdown start immediately. And critically, the clear advice at the time was that there's only a limited period that people would put up with it,
right.
would put up with lockdown.
And so
now that proved to be wrong
Quite.
because the British public have stepped up to what we've asked them to do.